Hi, we're here today with Dr. John Haskin. He is a psychiatrist with Beacon Medical Group Behavioral Health. Dr. Haskin, thanks a lot for joining us today.
Thanks for having me.
So people cope with anxiety, depression, uncertainty, fear in different ways, and one all too common way is through alcohol. Doctor, do you have concerns about people drinking as they spend more time at home, or those who are unemployed, their consumption of alcohol right now?
Yes, I do. I'm noticing in my inpatient psychiatric units as well as over at the main hospital, there's an incredible increase in the number of people with alcohol problems that are coming in.
Tell me, do you have concerns if it's one or two drinks that people are having, or when does drinking become toxic?
Well, there's new ideas about that. They say maximally 4 drinks in a day and 10 drinks in a week. So most of the people that I'm seeing are drinking way more than that.
These people that you're seeing too, how do they describe the issues that they're having, the feelings they're having, and even the problems they're going through that is leading them to drinking heavily?
Well, people are out of sorts as far as um, their normal day-to-day life. I mean, they're not going out, they're not going to work, um, they're in with the kids all the time. Some people have family members coming in that don't have funds, so there's financial strains, there's lots of anxiety. So people are trying their best to use what they've got. This used to work for them when it was just on the weekend or once in a while, but every day. There's information that the sale of alcohol in March alone, the first month of the lockdown, went up between 55 and 70%. So that's quite an increase.
That is quite an increase. How does it affect one's mental state? And I'm particularly interested in immunity. I mean, does it lower your immunity when you're drinking too much?
Well, there are two important proteins that the body makes. One is cytokines, and the other is macrophages. And these are the macrophages, like the old Pac-Man video. They go and eat dead cells and go after things that don't belong in the body. Alcohol can drop the amount of macrophages and cytokines down 50%, 75%. So you can imagine, with less of an army to keep your body healthy, you're more prone to get ill.
So healthier alternatives, what can you do instead of consuming alcohol if you're having these feelings of depression, anxiety, as we're discussing?
Well, one thing that you can do to improve your mood, if you do nothing else, you can stand up and march in place for half an hour. That will improve your mood. It's good for people who have depression or anxiety. It does very well. Another thing is play games. People don't know, you play games are for kids, but learn to play games. People learn to play the piano, sing, be active at home. And you know that it's becoming a problem if you hear from other people, John, you're drinking too much, or if your relationship is having problems because of the amount of alcohol that you're drinking. Alcohol lowers your impulsivity, so there's an increase in anger, aggression, home violence, not just men against women, but women against men as well. All these things are related.
So if you know that you need help, or if someone you love needs help, what advice do you give? Where can they go? What can they do?
Um, they can, it's real simple. They can call our Epworth, our admissions office. We're open 24 hours. That number is 574-647-8400. Or just come to Epworth. There's somebody here all the time at 420 North Niles Avenue here in South Bend. Ask friends for help. Do something, because this is a lifestyle change that the end of which is not yet here.
If you need help, get the help you need, right?
Correct.
Dr. Haskin, thank you very much. I appreciate you joining us today and for your insight.
Great. Thank you.